scarring is a difficult problem along the lines of stretch marks, stretch marks are essentially scars. There are a number of ways of addressing them, but really it boils down to trying to break up the fibrous tissue and allow for ingrowth of more healthy tissue, more collagen and elastin, things that make the skin look youthful and resilient. And there are a number of techniques to do that. The main ones are going to be laser and microneedling. To a lesser extent, the plasma pen can have a role, and then sometimes the radiofrequency treatments are useful for stretch marks. Scarring is difficult, can't lie. Usually requires more treatments on average than other conditions require. And the results, well, there's definitely improvement. It is rarely complete resolution. Most people understand this, I think. But essentially what happens is through one of the treatment modalities, let's take laser and microneedling as examples. There's repetitive shallow injury to the skin and the superficial dermal tissues. And following this, there's an immune response, an inflammatory response. And during that healing phase, that collagen and elastin are produced. This, obviously, in normal tissue, there's a reasonably predictable response. However, in scar tissue, the response is not always predictable or vigorous enough to cause an immediate result. You might need more treatments. The CO2 laser works through light energy, and we use a fractionated CO2, which means that it does not completely strip off the top layer of the skin. It just burns it enough that it causes the mild injury required to induce the reaction necessary. The microneedling does it through trauma to the area. Very fine needles pierce just the superficial layer down to about 2 to 2.5 millimeters. And to further enhance the effect, some radiofrequency energy is released at the bottom of that downstroke, which causes the injury in the right plane of the skin, the right layer of the skin. Personally, if I were going to choose one to start with, I would probably go with the microneedling because it is the most aggressive treatment that we offer. The laser is close behind it. Both of the treatments, the laser and the Potenza, can be used on all skin tones, including dark-skinned folks. Other treatments are restricted for use to lighter skins only because of risk of burns, but those two treatments are good for scars on anyone.